Hello all, welcome to Smart Classes. Today we'll discuss about the current affairs of Telangana in April 2020. And as you know, by April 2020, there was COVID-19 pandemic and lockdown has started. So from here on, most of the news will be revolving around COVID-19 pandemic. So the first news is the establishment of 5 new IMCTs to assess the situation and augment state efforts in COVID-19 pandemic. So, what is IMCT? It is nothing but interministerial central teams. So, it's like a task force which comes from the center and reviews the situation in the state. Whether if the state is taking right measures, social distancing is followed in the state, and all the measures related to COVID-19 pandemic, which is given by the ICMR, that is ICMR regulations are followed in the state or not. So, to review this situation in different states, these IMCTs will go to the states. So, the 5 new IMCTs which were established were two for Gujarat, one for Telangana, one for Tamil Nadu, and one for Maharashtra. Before this, there were already 6 IMCTs, which were out of which two for West Bengal and different states. So, here are the 5 IMCTs established in April 2020, out of which one was for Telangana. And this IMCT is headed by an additional secretary, and there are members of the IMCTs who are the officials from the central government. So, to investigate the implementation of lockdown measures under the Disaster Management Act 2005. So, this Disaster Management Act gives guidelines which must be followed during the pandemic, which is basically a disaster. So, here what you need to remember is what is IMCT, from where does it come, whom is it headed by, when did it come to India? That is in April 2020. The second news is Telangana CM recommended the implementation of helicopter money. Basically, there was a video conference of Prime Minister Modi with with all the chief ministers of the states. During this video conference, Telangana CM KCR, that is Kalvakutta Chandrasekhar Rao, has suggested to send in helicopter money to states. What is helicopter money? Helicopter money is nothing but money which falls from the sky, that is out of nowhere. So, the transfer of funds from the central bank to union and state government. That, that is, central government prints a lot of money and this money is transferred to state. And this is not a debt or this is not a grant. It is just a money printed by the central bank and it is sent to the state and central government to boost the economy and make people buy more and make the economy running. So, to make the economy running, CM KCR has suggested to print helicopter money and send it to the state and central governments. So, there is one more term called quantitative easing. Helicopter money is also a substitute of quantitative easing, but the difference is in case of quantitative easing, the money sent by the central bank must be returned back. And the bank takes the bonds from the government that the government will repay the money taken later. So, in case of quantitative easing, the money should be returned back. In case of helicopter money, the money should not be returned back, and both are done. Quantitative easing and helicopter money are given to boost the economy and make the economy running. And there were other recommendations also given by CM KCR in the meeting, out of which these are the three important recommendations. The first one is release 5% funds from GDP to boost economy and improve money circulation in the system. And the second is increase FRBM limit to 5% from 3%. That is, fiscal deficit limit must be increased from 3%, which is 3% right now, to 5%. And then the third thing is task force should be created to draft an action plan on helping farmers. So helping farmers is the main important issue in the third point. So And the task, he also suggested that the task force should have prime minister as a chairman, and the members of the task force must be the cabinet ministers. And then the third news is the low cost ventilators for G1 Light. Ventilators, which are known as G1 Light, have been made by the Aerobiosis Innovations, which is a startup at IIT Hyderabad. There's a center called Center for Healthcare Entrepreneurship in IIT Hyderabad, and there's a startup Aerobiosis Innovations inside this center. So this center has come up with the low cost ventilators, which is known as G1 Light. This G1 Light ventilators are also portable and and are having advanced technology, and are also of low cost to help the hospitals and the patients. And these ventilators can be run through mobile app using internet on battery for up to 5 hours. Even if the current goes off, these ventilators can run on batteries up to 5 hours. Can be connected to oxygen cylinder, and the price of this ventilators is around 1 lakh rupees. And then the next thing, as you're seeing till now, we have been discussing the measures which are revolving around COVID-19, and this also is regarding COVID-19 monitoring system, which is an app used by Telangana government, which is an app first time used by the Telangana government. It is developed by a startup, Vera Smart Healthcare, and it is launched by the Telangana Director of Public Health, Dr. G. Srinivasa Rao. What does this app do, and what is the objective of this app? The first one is identify patients, live surveillance of the health of the patients, and monitor and also track the progress of the COVID-19 patients, the progress of health and the health conditions of the COVID-19 patients. Each caller needs to handle more than 1,500 calls, and there's also chatbot interaction with the patients in this app. Based on IOC, Internet of Things, GPS, and geotagging, this app basically works. And then the fifth news, which is CSRIICT collaborates with Luxi Life Sciences to reduce the dependency of APIs and drug intermediaries. Basically, APIs are nothing but active pharma ingredients and drug intermediates. Basically, these things are used to manufacture medicines or drugs. That is, drugs for health purpose. So these ingredients are currently imported from China. So, if we develop our own active pharma ingredients and drug intermediates, the dependency of our country on China decreases. It reduces the dependency of India pharma on Chinese imports. So, this collaboration is really essential for our countries to stop the dependency on China for active pharma ingredients and drug intermediates. That's it for the month of April. Thank you. See you in the next video.